Hi, everybody. Upload this way, but for all students who are about the front office, and for maybe someone who is an RDA who wants to kind of retire doing the front office, this video is for you. Okay, I don't want to waste no one's time. It's Saturday and it's hot in Tennessee, but we're going to go over this. And if you would like to have a copy of everything that I'm reading, I can put a PayPal link for $5, and you will have these notes to have next to you, including my personal little outline, what to ask for a breakdown. Okay, so here we go. Tips for successful dental insurance claim submission. These tips will gather from discussions with dentists who work for insurance companies, dental consultants, and offices that have successfully implemented protocol to maximize their dental insurance claims. Okay, because you don't want to get a claim rejected, because then you have to go through the loops, which you will have to, if you're going to do that, to get that check back in, because that's part of your profit sharing, your bonuses, so you can't just leave it doormat. Okay, Xrays. Do not send, now this is old school, okay? Because now a lot of days you just do it on the EagleSoft or Dentrix via that way, the internet. But if you do have, there are some old school dentists out there still. I've walked into them for job interviews, trust me. So if you have that kind, nothing wrong with that as long as it works, right? But do not send original X-rays. Always send duplicates or copies, okay? If you want X-rays returned, you must include a stamped self-addressed envelope. They're not going to return your X-rays, which is the dentist, he owns that, but they're not going to return unless you give a self-addressed stamp. Send X-ray documentation for these procedures. Crowns, fixed bridges, buildups, okay? A lot of dentists don't do the buildups, and it's like that's an extra what, $85? That could be, $85. You got 4 or 5 crown preps. I mean, that helps. Posts, implant supported crowns and prosthetics, scaling and root planning, okay? Periodontal surgery, gingival flap procedure, crown lengthening, bone grafts, and osseous surgery, OSSEOUS surgery, surgical extractions. So let's review that. Send X-ray documentation for these procedures. Crowns and fixed bridges. Okay, so make sure before you even get started that you have a current X-ray of that tooth. Buildups, posts, implants, supported crowns, prosthetics like dentures, scaling, root planning, periodontal surgery, surgical extractions. Okay. Send appropriate pre-op and post-op X-rays. Send pre-op for restorative, endodontic, periodontal, and surgical procedures. So if you send a pre-op, like you want to get an estimate prior, so the patient will understand what their part's going to be, so there's no discussion, there's no argument about it. You can always put it back onto the insurance company. I once worked for a dentist that told me that insurance was basically like a coupon. Okay, you only get a little bit off. So, and patients are going to go to the front office person. And you ever notice that sometimes they get treated worse than the back office because, the dental assistants and the doctor, they got the needles and stuff. In the front office, they get the grunt of the work, It's always going to be that way, okay? Because you're asking for the money, but you have to be brave enough to ask for the money because that's paying everybody in that office salary. If you're not doing your part of that job, then you're not going to get a paycheck. And that's not going to work out. Okay. Okay, for teeth with questionable prognosis, send a post-op X-ray documenting successful results. For custom, indirectly fabricated posts, send a post-op X-ray documenting that it is deemed a custom post and not prefabricated posts. Pre-op means prior to any operative procedures, before crown prep, before filling removal, before endo, and all that. Send quality, clear diagnostic X-rays. Okay, so when your boss says, "Oh, I can't use this X-ray," it's overlapped, there's a reason, or if it's foreshortened or elongated, you have to have just the right x-ray. If you don't know how to do x-rays, you have to learn. And I have a video on that. So send quality clear diagnostic x-rays. Look at the x-rays that your office staff is sending out. You might be surprised by the lack of quality. Okay. Make sure the entire tooth in question is visible on the x-ray. Make sure exposure matches the original, not too dark, not too light. Make sure the contrast is adequate and details of tooth, restoration, bone, and pathology are clear. Also, you can send a intraoral picture as well. That is just, I mean, it's in the picture. Choose appropriate x-ray views. Periapical and bite wings are usually more diagnostic than panoramic x-rays for many conditions. Panoramic x-rays might show an entire tooth to be extracted that cannot be imagined with periapicals, okay? So make sure you always have that x-ray. And I know some patients it's very difficult to get that x-ray, but there are techniques that you can do. Do not send too few of x-rays. The reason we take more than one x-rays is because different x-rays show different things. So include them. If submitting for a period procedure, don't send one periapical, send bite wings if available. And you probably should do vertical, not horizontal, because it shows the root. Or if a full mouth series is available, send it. If a panel is also available, send it also. The more evidence you have, the faster the dentist will get the payment and he will be pleased with you. Do not over manipulate digital x-rays. Don't play with them too much. Some doctors like to draw the arrow and show where it's at. They're asking you not to do that too much. Bigger is not necessarily better. Do not send photos. That's what it says. Do not send photos that are too large. One x-ray filling up an entire page might seem like a good idea, but it is actually an overkill and can slow down processing. Large printed x-rays often are grainy and are more difficult to read. Print x-rays on photo paper using a photo printer. Label x-rays with left, right, patient's name, x-ray, and date. Label, add arrows, notes on the x-ray to call attention to details you want to be seen. However, do not write extra notes in a way that covers over the important information. Periodontal charting, send period chart for these procedures, the scaling and root plane. I mean, it's important you mark those bleedings, okay, if you're using software and stuff like that. Period chart include a minimum pocket depth measurements for all teeth in the area procedures and indicate missing teeth. Do not throw in the kitchen sink. Including every possible finding that might get a procedure covered can call credibility into question. Be truthful. Include anything that you have actually documented in the patient's record. Do not include anything that is not documented in the patient's record. Okay? Other attachments. A copy of the actual clinical notes can be helpful in documentation. Examination findings and accompanying diagnosis. Diagnostic process that was used to actually diagnose the cracked tooth syndrome. Level of surgical involvement for extractions. Pathology reports can help document biopsies, cysts, tumors. Reports from the specialists. Those letters are very important. You need to save them. Claim form. Use the latest, most up-to-date ADA claim form. Use the most current CDT codes. And I have that book on my dental index. I'll leave the link below. But you do have to use the current ones because they do change. Okay. Full crowns, bridges, and other fixed or removable prostheses are currently note whether it is a replacement or not. Prior placement refers to crowns, bridges, inlays, onlays, veneers, removable appliances. It is not referring to prior placement of fillings. Note missing teeth in the missing teeth information section. Enter the correct entity in the billing dentist section and correct dentist in treating dentist section. So at some places they have more than one provider. So you have to make sure you're using the right dentist, even though one uh, Dr. John Doe, he owns that practice, but Dr. Jamie Doe is the one that did the procedure. Make sure that you put her name down, okay? And license number. Let's see here. Some codes require area of oral cavity and others require a tooth number. This depends on the CDT code, so they have to correspond with each other. And insurance company guidelines. If a patient's discount is not already calculated into the fee on the claim form, the discount amount must be clearly reflected on the claim, either as a separate line item or in the remarks. Otherwise, a fraudulent claim is being submitted. Let me repeat that because that could be an accident for anybody. If a patient discount is given, which some dentists do, is not already calculated into the fee on the claim form, the discount amount must be clearly reflected on the claim, either as a separate line item or in the remarks. Otherwise, a fraudulent claim is being submitted. Yeah, a lot of people do that. So touch up on this. Miscellaneous tips. If you'll be doing more scaling, root planing, or osseous surgery in other quadrants later, but not submitting for all of them on the claim, go ahead and include the X-rays parallel chart in all four quadrants anyways. If you do this, some consultants will automatically pre-process all four quads and store it in the computer, which will save processing time on the future submission. So save yourself time. If you know they're coming back for quadrant and scaling, go ahead and just submit all of it then. Use the correct terminology. For example, do not write prognosis if it's actually a diagnosis. Do not refer to a restoration as an onlay if it is actually an inlay. Become intimately familiar with the CDT codes and the descriptions. Reread them regularly to refresh your memory about the descriptions for the codes you might not use very frequently. Make sure the entire office staff is familiar with them, including the doctor. Everybody should know the codes. If you need to, what we used to do at the office at Dr. Kelsel's, we would just write them on a sticky note and put them next to the ones that we would use quite often or not as often. If you get a request for information after submitting a claim, then send the requested information plus more. This means the claim is being evaluated by a human rather than processed by a computer. Make sure you include information clearly documenting what you did and, more importantly, the necessary for why you did it. If it's not immediately evident in the X-ray, explain it in a narrative or send photos. Okay, that's where you enter or photos can come in. Because sometimes you can see it, a hairline fracture on that, but you can't see it on the X-ray. So that's what would help. Do not request a phone call in hopes that it will increase payment likelihood unless you actually have information that needs to be discussed. Insurance companies are not more likely to pay a claim just to avoid the bother of making a phone call. Any phone call request will delay the claim processing. Maintain good patient record. That's why a lot of dentists go ahead and pre-write the notes and you just click and put the tooth number. That's very smart to do. Document exam findings and specific exam actions such as how a cracked tooth was diagnosed, pulp test. You can charge out for pulp testing, and specific results. Document any x-rays taken, that they were actually read, and which dentist read them. Document all pathology, document decay findings, document treatment plans, document referrals, and reason for referral. You have to document all this. Document patients' discussions, document actual treatments and details. Now, for some reason you're not getting paid, you're going to have to appeal it. Okay, if resubmitting a claim, On appeal, send additional documentation of some kind. Don't just resubmit the claim in hopes it will be reviewed differently the next time, okay? Additional narrative explaining your claim submission, additional or better x-rays, additional or better photographs, additional or better chart notes, additional or better pathology report. Write appeal on the resubmitted claim. If claim is being resubmitted with corrected information, write corrected claim on it and call attention to the corrected information. Call attention to new information being submitted. So make it stand out, highlight it, put a little sticky, get a stamp that says resubmitted claim, because you know you're going to use it more than once, because sometimes they are just spitted out by the computers and not checked by a human uh, insurance rep. Things to remember: if payment is denied for a procedure, this does not always mean you cannot do it. It simply means that it is not a benefit in the insurance plan that the patient's employer purchased for them. So just know, oh, well, they didn't do that MOD composite filling for you, so we can't do it. No, you can still do it. Submit quality x-rays. If you cannot see the condition in question on the submitted x-ray, then nobody at the insurance company can either. Do not commit insurance fraud. This can be very costly in terms of legal costs, reimbursements, and dental board sanctions. Fraud can take many subtle forms, such as, I'll read a little slower. If you need to, you can rewind it. Sometimes you don't know what you've been taught. So here we go. Submitting date of service that is different from the actual date you did the procedure for the patient. Insurance fraud. Submitting a fee that is different from the fee you actually intend to collect from the patient, unless you have a contract with the insurance company. Not collecting copay amounts. Submitting a CDT procedure code that is not the most current one for the procedure actually done. Submitting fillings that are on more tooth surfaces than were actually filled. Submitting perio chart that shows deeper perio pockets than patient actually has. Misrepresenting cosmetic procedures as having other necessary. That's a big fraud one. That happens a lot. Insurance companies usually can request copies of records to investigate the validity of any filed claim. This concept is true for any insurance claim, not just dental insurance claim. Keep in mind the philosophy of legal experts. If it isn't documented in the chart, then it didn't happen and doesn't exist. What the dentist says actually carries little importance compared to what the patient's record says. This is especially true for dentists who have been placed on a targeted review by the insurance company. Yes, they can be targeted and be reviewed. Okay, that is it. Let me go over the breakdown. So we're going to pretend we're calling an insurance company. This is for students. I know some of you guys have probably done this many times over again, but I'm the dental assistant tutor. So got my t-shirt in today. Gotta look professional, right? Old school there. So anyway, when you're getting the insurance verification, this is what you're gonna do. You spoke with who? Okay, make your little stuff, a little cheat sheet, order this one, whatever you need to do. Spoke with who? Make sure you get that insurance rep's name, the date. Okay. Then you're gonna find out insured. Who's the head of the household, the date of birth, the social security number. Is there a spouse? Okay. Dependent 1, 2, 3, 4, how many ever dependents there are, you will have all their date of births and social security numbers. Okay. Have it already written down so you don't have to look and make them wait. Okay, insurance company. Make sure to get the correct states, okay, of the insurance plan. There's Delta Dental of Tennessee, there's Dental of Minnesota. So make sure you have the right states. The address and the phone number. So always make a copy of the insurance card front and back. Address and phone number. The employer, who is giving the insurance, okay? Not the wife's employer who's not providing it, but just to clarify, but who is giving this insurance to their employee. You want to write that employer's name down. There will be a group number. You want to have that group number written down prior because you should have this information on the card. That's what they're going to ask for. Insurance used to date, that's a question you're going to ask them, okay? A lot of people forget to ask them. Benefits run calendar year or is it birthday year? When's the effective date? They could have just got the card, but it may not be good for 3 to 6 months. You don't know. There could be a waiting period. Insurance used to date. They might have went to another office, got a full FMX, and you don't know it, and you're about to charge them for it. So, and then you're not going to get paid for it, and then you're just going to be another one on the list. There are those patients, okay? So, what has been used to date? Call before they come in. Call the day before. Tell the patient you need this information, okay? Save yourself time so you're not doing it right then and there when they show up. That makes them obligated to come into the office. Okay, yearly max. What is their yearly max? Everybody has a different yearly max. Max used year to date. Deductible. Do they have a deductible? How much do they have to pay prior? Has it been met? They could have paid it already. Includes preventative. Does it include preventative? It might not include pro fees. It might include just extractions, you know. Some insurances are weak. Let's be truthful. Waiting periods. Are there any waiting periods? Uh, what is the percentage for preventative, basics, and major? Okay. Preventative is your sealants, your prophies, exams, basic, you know, restorative and stuff like that. And major is like your crown and bridge and all that. So preventative, what is the percentage that they cover? Basic, write down the percentage that they cover. Major, what is the percentage? And then you can add this all into the computer. Ortho, do they cover ortho? And up to what age? Okay. Hey, maybe mom or dad can get the braces on, you know. Oral surgery. You know, a lot of people don't understand that this is all broken down, and we are the ones that need to educate the patients to get them to pay for their treatment. So, oral surgery, they can have a toothache. How much are they going to cover for that? You know, perio and endo. The three items can be basic or major, so always ask. Okay, so oral surgery, perio, and endo are sometimes considered basic and sometimes considered major. So make sure you ask, okay? Got a fly in the house. Limitations. Uh, how many exams can they have a year? Prophies. You'd be surprised. Some people can actually get 3 to 4 prophies a year. Bite wings, you know, is it once a year, twice a year? The Panorex, the FMX, you know, can they come together? Fluoride, up to what age can they have fluoride? Sealants, and also what up to what age? And limited exam, 0140 is the code. Okay. Get it broken down because you can actually charge for a uh, regular exam, a prophy exam, and a limited exam or emergency exam. They're all different. Okay. Posterior composites, can they be downgraded, you know, to amalgam? Yes or no? Implants, 60/10. Yes or no? Do their insurance cover implants? That's a big thing nowadays. If not, get on Care Credit, something. In-house financing. Boom Cloud, you know, when I was leaving Dr. Kelsey's office, he was getting on Boom Cloud. That's a good one, you know. Check that out. Don't be left in the dark. Other dentists are offering things. If any dentists are watching this, we got to get the staff raises. So that's why I'm kind of helping out with this. Um, Also, split therapy, 9940 is the code. Yes or no? Implant crown 6056. Is that covered? That'd be great if it's covered at 50% and the implants covered at 50%. That's going to help them. Maybe it's covered at 80. COB, yes or no. Gender or birthday rule. And then the missing tooth clause, does it apply or not, or doesn't matter? And then crown replacements. Can they have had a crown for 3 years, 5 years, 7 years, or 10 years for crown replacements? Are crowns paid on prep date or seat date? Most people get paid half down of the patient's portion and then the other half when they come back, if you don't know how to do that. Or a patient may pay for their whole half up front. Try to get it that way too. That way, when they come in for their seat appointment, you say, "Oh, you just come get your crown, and then you can leave, free to go." That will help. And then their denture replacements. Is it 3 years, 5 years, 7 years, or 10 years? The history on that. Make sure you just get the history, okay? Don't be fooled by a patient saying, "Oh, I just got an insurance and I need to get this done," and then you check their insurance after they leave. That's not good. Always get a copy of their insurance card and driver's license. We're living in a day and time that's not too safe. Don't forget to like and subscribe if this helps you. If you want a copy of this for $5, just so I can make copies and mail it out, I'll do that for you. Great little notes to have nearby if you're thinking about doing the front office work. Because sometimes you can't find a back office job, a chairside job, so you might want to dabble into the front office. And also, don't forget, I teach that and have courses. Check out the dental index. I'll leave the link below. Enjoy your Saturday, guys. Bye.